Hi, this is Dr. Jerry Hizon. I'm here to talk about the STAR and HEDIS measures for 2018. STAR measures are disease management metrics. They look at screening, tests, and vaccines. They look at the assessments we do, how we take care of our diabetics, care of the older adult, as well as medication management. So with disease management, we're looking at fractures, blood pressure control, rheumatoid arthritis, and statin use for cardiovascular disease. So for disease management of fractures, women over the age of 67 up to 85 who have suffered any fracture within 6 months should have a DEXA scan or initiate biphosphonate therapy. For blood pressure, patients between 18 years old and 85 years old with hypertension need to have their pressure adequately controlled. You need to repeat all readings and record both. If you're over 18 and have rheumatoid arthritis, that needs to be treated with a DMARD agent. For statins with cardiovascular disease, if you have cardiovascular disease, males between 21 and 75 should be on a statin. Females between 40 and 75 should be on a statin medicine for cholesterol control. And with cardiovascular disease, who fill at least one statin in the moderate to high dose intensity. Now let's go to screening of breast cancer, colon cancer, and also flu vaccine. So females between 50 and 74 who have had a mammogram in the current year or prior year get credit. For colon cancer, between age 50 and 75 who have had appropriate colon cancer screening. So you can have a colonoscopy in the last 10 years, you get credit, a sigmoidoscopy in the past 5 years, or a fecal occult blood test within the current year. And on the flu vaccine, they need to have received a flu vaccine for an annual prior to the flu season each year. Now we'll look at assessments of body mass index, physical activity, fall precautions, and bladder control. So for body mass index, you need every calendar year to have when they're between 18 years old and 74 years old, their body mass index calculated and documented, particularly in the billing. For physical activities, patients who receive advice from a clinician to start, increase, or maintain their level of physical activity in the current year get credit. And for those over 65, you need to document that they have received fall precaution and fall screening in the current year. For bladder control, patients over 65 years old who received urine leakage screening in the current year, and they need education if it's needed. Now for diabetes. Patients between 18 and 75 years old need to have a hemoglobin A1C that is less than 9% in the current year. In kidney disease, diabetics between 18 years old and 75 years old who've had a microalbumin testing in the current year need to have that documented. And not just a urine analysis, it has to be a microalbumin. For diabetics between 18 and 75 years old, they need to have a retinal exam in the current year documented. And those patients with diabetes between the age of 18 and 75 years old who were dispensed at least one statin of any intensity in the current year get credit. Now let's talk about the older adult. Let's look at their medications, their functional status, and their pain screening. So patients over 66 years old who've had a medication list, that needs to be reviewed by the clinician once in the current year and documented. For those patients over 66 years old who've had a functional status assessment such as ADL, Activities of Daily Living, once in the current year and documented. And over 66 years old who have had pain screening once in the current year, and of course, documented. Now let's talk about medication management. So if the patient is over 18 with diabetes, they need to have filled their oral diabetic medicines enough to cover 80% of the time they're supposed to be taking it to get credit. And for those over 18 who are supposed to be on a statin medicine, again, they have to fill the prescription over 80% of the time that they are supposed to be taking the medicine. Now, with the hypertensive patients, those over 18 years of old who fill their ACE or ARB blood pressure medicine or the direct renal inhibitor medicines, again, blood pressure medicines, often enough to cover 80% of the time that they're supposed to be on it. And for medicine reconciliation, if they've been discharged from a hospital, within 30 days, they need to have medicine reconciliation. And this documentation must include either the provider who reconciled the current medicine and the discharge meds and the current meds that are referenced in the discharge. So all of that has to coordinate and be together and documented. And then for all-cause readmission, the percentage of patients discharged from the hospital stay who are readmitted into the hospital within 30 days, either of the same condition or a different reason, is an inverse measure. You want that to be very, very low. Now let's look at the HEDIS measures for prevention, disease management, and antibiotic use. So obviously there's a lot of prevention and screening tools. We won't go through the pediatric immunizations. They're here for your review. But by the 13th day, or 13th birthday, the patient should have gotten one meningococcal conjugate vaccine. They should get the Tdap, which is the tetanus and pertussis, and they should have got either their second and or third HPV vaccination. And by their second birthday, we need to check them for lead. This is a medical requirement to make sure they haven't had lead poisoning. Now, women between the ages of 21 and 64 need to have cervical cytology, basically a pap smear, every 3 years. Or if they're between 30 years old and 64 years old, they need to have co-testing of cervical cytology and the HPV testing every 5 years. So if you have both this pap smear with HPV, you only have to do that every 5 years. And women between 16 years of age and 24 years of age who are sexually active have to have at least one chlamydia test during the current year. And women between the ages of 50 and 74 need to have had a mammogram in the current year or the prior year, again, of course, documented. And now we look at weight assessment and counseling for children. If you're between 3 years of age and 17 years of age, you need to have your body mass index, BMI, percentage documented. And you need to counsel for nutrition, physical activity. Obviously, this needs to be documented and in the current year. And finally, for disease management, there's comprehensive diabetic care, blood pressure control, medications, and asthma control. So for the diabetic care, diabetics between 18 years of age and 75 years of age who are in the current year must have at least one hemoglobin A1C. Ideally, that hemoglobin A1C must be less than 9. They need to have their retina exam, so their eye exam, microalbumin, which is a urine test to look at the kidneys, and they need to get their blood pressures between the top systolic under 139 and the bottom or the diastolic under 89. And then patients who are 18 to 85 years old with hypertension, that pressure needs to be adequately controlled, and those are the numbers there. And if you're on digoxin or some of these blood pressure medicines, ACE inhibitor or an ARB or a diuretic, they need to have lab monitoring in the current year. Digoxin also requires a serum digoxin level, and that's a medicine that they use for congestive heart failure. And for asthma, patients with asthma between the ages of 5 years old and 64 years old with persistent asthma who are dispensed appropriate asthma control medicines need to have picked up those blood pressure or those asthma medicines at least 75% of the time. Now, adolescents will switch over, but in the first 15 years of life, we can also go ahead and go over that. Ages 3 to 6 who have had one well child with a primary care physician in the current year get credit. And now for adolescents, ages 12 years old to 21 years old need to have a comprehensive well checks by the PCP or OBGYN during the current year. And for ages 12 to 6 years old who have had at least one visit with the PCP. Now, ages over 20 and older need to have at least one ambulatory care visit or preventative care visit this year. That means every patient, especially with our insurance called Regal, need to come into the office at least once a year for a well visit. We'll kind of skip over the gynecology section of this. Antibiotics. So we need to have appropriate testing for pharyngitis. We don't want to give viruses antibiotics since they don't work. So you need to test for pharyngitis, have a positive strep test before you use any antibiotics. Appropriate treatment for children with URIs, usually the upper respiratory infections or viruses, so they should not be on any antibiotics. And avoidance of antibiotics for acute bronchitis because most of those are viral. And for patients between the ages of 3 and 18 who are seen with a diagnosis of pharyngitis, they need to have a positive strep test within 3 days of the visit. And any patient with more than one diagnosis during the encounter actually can be excluded. So if you have more than one diagnosis and they're on antibiotics, you do get excluded for that. And then children between 3 months and 18 years who were given a diagnosis of URI, you actually get credit if you don't give them antibiotics. And patients with more than one diagnosis, like the last time in this encounter, can be excluded. Now, for patients with acute bronchitis between the age of 18 and 64 years old with a diagnosis of acute bronchitis, you get credit if you are not putting them on antibiotics. So in summary, the HEDIS measures, while they're a bit on the tedious side, are very important metrics to try to prove that we are doing quality medicine here at Motion Sports MD. Thank you.